You know, the last couple of years have been pretty rough here in Travis County, but I am real proud of what we were able to do with respect to COVID. You know, the mortality rate in Austin, Travis County, less than half of the mortality rate in the state of Texas. If the state of Texas had the same mortality rate that we have in Austin, Travis County, over 45,000 Texans would still be alive.
One of the first things that we ran into was a surge that was happening around late December, January. We had to make the decision about having a curfew, which we ordered a curfew for New Year's Eve because cases were so high we didn't know how to deal with those numbers in the hospitals.
For us in the first responder community, specific to COVID, usually we're in a get a call, go fix a problem, be done. But this was a lasting issue. And initially our concern was we didn't have a lot to add to that problem. And thus we started to get involved with some other players so that we could directly impact the community through the way of a vaccine program.
The alpha wave of COVID, people were really, really sick. And so I think that it was very hard for our medics to both try to quell the anxiety that patients had and also see people that sick, because we are just not really used to that. And so not only are we the ones that are supposed to, have the most presence and be in charge and be a comforting presence, that was especially hard to do because it was all new to us as well. And a lot of our medics faced the same thing that everybody else faced at home, which is taking care of elderly folks, immunocompromised kids. We had medics that moved out of their house for months because they could not imagine bringing COVID home to their kid.
You know, the Travis County Democratic Party stepped up in a great way. They did a phone bank for us when we were out there getting resources to communities for vaccines. We started the first mobile vaccine collaborative here in Travis County that was recognized, I think it's the first in Central Texas, that was utilized in other counties. The Travis County Democratic Party, what they did is they became a support network for us, making phone calls for us, getting some of those people in the underserved communities through a phone bank, let them know where our next vaccine clinics were going to be at.
So we should be really proud as a community. We should be proud of the leaders that I had a chance to work with. We should be proud of our healthcare professionals because they saved lives and they saved thousands of lives. And I am just really proud of the way that we did that.
It took us 72 hours for Andy Brown, for all of our leaders to come together. And we ended up not just providing 600 vaccines on that day, that grew to 5,000 vaccines a day at the Circuit of the America, managing over 150 clinical volunteers and so many other volunteers that came up. So when you talk about what individuals stood out, the community stood out. They came forward and they said, we are here for you. We're not going to isolate ourselves. We're going to take care of each other because frankly, the only way to get through crisis is together.